right, Dave, are you ready for us?
I'm ready for you. You ready for me?
Come on in.
All right, well, we'll get you started.
Okay.
In the old days, we just used to use lasers and line you up, and you know, we had huge fields. Now, because everything is so much smaller, we can get really pinpointed. So we do a small CAT scan on you and they line it up. So here, this bigger one you can see is your original scan that we planned on, and this little circle is the one they took today. So what they do is they're lining you up to make sure you're absolute. So this is looking at the cone beam from today versus that one. So if when you go back and forth, we can see that you're in line. And we're exactly hitting it where we want to. Here's your hips, your spinal cord, your kidneys are up here. I can show you here. What I do is I draw in all the critical structures. And here, this slice is as if you're a slice of bread and we've sliced you, and we're looking at you as if we're putting the butter on. So this is looking at you from your feet up to your head. So here's your hips here. The yellow is your bladder. This is your tip of your sacrum back here. As we scroll up through this one, these are what the doctor's volumes are he wants to treat. This orange here is your bowel, and that's what we want. That's why we want your bladder full. If you look at this one, this is looking from the side of you. This yellow is your bladder. You can see when it's full, all your bowel is pushed out of the way. That's why they're so picky and always are torturing you to have a full bladder. I'm Rosemary Donatello, and I'm a medical dosimetrist, and I do all the planning and calculations for radiation therapy treatments for patients with cancer. The doctor has drawn what he wants to treat, and my job is to figure out how to get it in there. So this is actually your plan. Your plan consists of 2 arcs, and you can see these little hash marks. This is it going around, and then it goes back around. And I'll show you with the dose on. Make it look real pretty for you. This is the dose in, let me put it in actual dose for us. Absolute dose. So you can see the blue is, every part of you is getting it, some dose, but very minimal. The actual prescribed dose is very tight. These are the lymph nodes the doctor's treating, these right here. And they go up. And then as we come down, you'll see it'll get a little brighter, because this is where your prostate was. It's in between. This is your rectum back here, and this is your bladder. Once again, the bladder is pushing everything out of the way, so we're not treating it. And this is the doses. So you can see we're nicely staying off your rectum and off your bladder. And to show you what it looks like when the machine's turning on you. This is like a 3D rendering of you. Let me just get the table out of the way. So here's your bowel. Your bowel, you can see your hips here, the bladder. This is the area we're treating. This is an actual what the machine sees. So this is the beam's eye view from the machine. I'm gonna turn this. Let's turn this off. So this is what the machine's seeing, and this is the area. I'm also gonna turn it off. The isolation. So this is what the machine sees, and this is what it does. This is actually, as it's rotating, this is what the beam's eye view is. So all these little leaves are blocking all the areas. And where you can see it's no leaves, that's what's open, that's what the radiation's going through. This is called intensely modulated.
Way above my pay grade.
So this is what the machine is actually doing as it's going around you. You can see this is your body. It looks like your body's turning, but actually you stay still and the machine turns. So that's what it's doing while it's rotating around you, to make sure that we're staying off all these critical structures and only treating the area we want to treat.
Looking good, we'll get you down. Congratulations.
Before I ring this bell, I just want to say thank you from the bottom of my heart to every one of you. Your smiling eyes and compassion and optimism have exceeded my expectations. God bless you all.
Thank you.